Deer Track Farm has sort of mirrored the development of food animal practice. And I've seen it during my 44 years of experience. You know, when I went to vet school, you learned about how to treat sick cows. And then there was a concept that they call herd health, which was not how so much to treat sick cows, but how to prevent cows from getting sick. And now that concept has been moved further forward to what's called production management medicine, which you're dealing with healthy animals and trying to make healthy animals more profitable for the owner. And that's what we see has happened with Deer Track Farm. We're not dealing with sick cattle at all. We're not dealing with preventing diseases in cattle. We're dealing with trying to take healthy cattle and make them more productive. That's what Bob Schaefer's endeavors are geared toward, as most of our day is not spent at all with a sick cow or even preventing sick cows, but rather with the production management medicine aspect of veterinary medicine. That's rewarding both for us and the client because it makes them more profitable. And you know, treating sick cows is a tough proposition. You know, it doesn't always go the way you like, and it can be pretty discouraging at times. So we like the production management medicine aspect of it. When I started working with Bob, he was looking to sell cattle. And then after a while, he was looking to sell good cattle, better genetics, that type thing. And then as things went along, he was looking to sell good, healthy cattle. So, you know, that brought into play, you know, a health program involving vaccinations and parasite control and these type things. But it didn't stop there. As we went along a little bit further, especially from the reproductive standpoint, as you've seen with the use of embryologists and so forth, he was looking to improve the reproductive potential of the animals, particularly the bulls that he sold. So that became fairly standard practice to do reproductive evaluations and breeding and soundness exams on the bulls that he sold. But it didn't stop there. And now, a later innovation with him is he's looking to sell bulls that can get cows pregnant, but that are structurally sound, that will stay with, that when he sells a bull, that bull will be walking around doing his job 4 years from now. And of course, in the meantime, all the practices that we can provide Bob Schaefer at Deer Track Farm to improve these situations, that's what we try to do.
Well, I guess one thing that I've added to the practice is the use of ultrasound for pregnancy diagnosis, and that's something a service we didn't previously offer, and one that we've started using here at Bob's farm over the past few years. So now when his cows are being checked for pregnancy, we're also sexing the fetus, which helps him determine what he's going to do with that cow, whether she's going to sale, whether he's going to keep her. So that's been a change in his reproductive program. And I would say, going along with what Dr. Frank just said, that it seems every year we tweak his program a little bit, and it's never good enough for him to just do what's satisfactory. Because often he says, well, what do we need to do here? And we'll say, well, this is acceptable. This is what a lot of people do. If you want to go above and beyond, this is what you can do. And that's what he chooses. So every year is a little different, but always moving in a good direction. Well, the vast majority of our beef clientele here in Virginia, it's almost all cow-calf, and it's almost all commercial. So Bob is a purebred producer, and I think in the past few years he's become a premier purebred producer, and he's really, really going over his genetics with a fine-tooth comb. He is evaluating bulls for structural soundness, which I think is at the cutting edge of what you need to do with bulls if you're selling them for use. He's pretty aggressive with that, and he stakes a lot on his reputation as a seller of bulls. So I think he's really at the leading edge of what's being produced here in Virginia.
He also stays on top of his cattle if he detects a problem. You know, whether it's an eye problem or a foot problem or a cow off feed, she doesn't drift along too long before he's on top of it and we're here.
There was a day this past winter that I came here. It was 10 degrees outside at 2 in the afternoon and ice everywhere. And he called me and he had a sick cow that needed to be looked at, and I did make it eventually. And he asked me, did I come on a sled? But that cow, I had initially given almost 0 chance of survival, and she's standing out there grazing today. So it was worth it.